Dr. Kulshreshtha is our very own specialty provider, and he is pinch hitting for us. If you hadn't heard, yes, we did have Dr. Rebecca Gottsman on our program agenda for today, but in recent weeks, the federal government has put an embargo on the presentations and communication issued by governmental agencies, including the National Institute of Neurologic Disorders and Stroke. Dr. Gottsman is a federal employee and she has to comply with the directions of the new administration. And part of that is that anybody who is working for our governmental agencies has been prohibited from communicating and traveling to meetings until they get certain approvals, which have not yet been obtained. So at this time, Dr. Kulshreshtha is going to talk to you about what he was going to talk about next month, but we're going to talk about it today. And it's a very important topic because a lot of people who suffer from cognitive problems or trouble with their memory, trouble with the way their brain works, have underlying comorbid or chronic illnesses like heart disease, congestive heart failure, and hypertension. And Dr. Gottsman was going to talk about strokes, but Dr. Kulshreshtha is similarly going to talk about cardiovascular diseases like congestive heart failure, cardiovascular health and cognition, getting to the heart of Alzheimer's. So Dr. Kulshreshtha, you have the floor.
Thank you so much, Monica, and it is a pleasure to be here. Good afternoon, everyone. And I always find this very interesting that that John Lewis just started this whole session with saying that cardio is life, and that is absolutely true. And I feel like this talk is actually even more relevant this month because of it being the American Heart Month. So, as Monica mentioned, I'm a primary care doc, so I care about your heart health, I care about your brain health, mental health, and I my real goal is basically that all my patients are healthy and they age really well. So, in my research hat, I also look at how heart health affects brain health. So, I'm going to give you an overview of this whole field, plus also emphasize about what kind of a cardiovascular epidemic we are facing in the United States. So let me begin my talk here. Just give me 1 second. All right. So we'll talk about what is cardiovascular health. We talk about disease all the time, and I feel like it's time to reframe our conversation to not talking about disease, but talking about health, right? Um, you are aware of the huge disparities in Alzheimer's disease and dementia. There are similar disparities in the area of heart disease as well. We'll touch on those as well. And I'll lay out some of the work we are doing to establish what is the role of vascular and other risk factors that we are aware and how that affects Alzheimer's. And as mentioned earlier by Marisa, heart health is equal to brain health. And I'll show you a lot of evidence to make this point. But let's look at some of the real stats on why this area is so important. You might be all aware that heart disease has been the leading cause of death in the United States since the 1950s. And one person dies from heart disease every 34 seconds in the United States. So if you think of it, in 6 in 10 US adults, which is almost like greater than 180 million US adults, will expect to have a heart disease of some kind in their lifetimes, right? And there are disparities, as I mentioned. So 1 in 3 deaths among women each year is from heart disease and stroke, and it's more than all the cancers combined. And interestingly, in women, the heart disease also manifests differently. So sometimes they have more of what is called as a silent heart attack, where women don't even know that they have gone through a heart attack. And the problem is worse in Black and brown people like me who are prone to having more heart disease, but also they have heart disease and these risks much earlier in life. I often tell stories to my trainees that we sometimes find in clinical practice where a dad is wheelchairing his son to when he has had a heart attack, and that kind of thing is heartbreaking. So I'll show you more to support what's going on. But as scientists, we all like to not only study the current state that we are in, but also project what's happening in the future, right? You know that there's so many devices, so many medications that are available for heart disease, but the projections don't look any good. Even with all that we have for heart disease, stroke, and other things, and heart failure, the number of medications have grown in the recent decade. The projections kind of look pretty bad. If you look at this graph over here, the red line showing heart disease will continue to increase. And so is stroke, which is shown in green here, right? And heart failure will also stay high, even with all the medications that we have. The orange line is for true heart disease, while the red line is all that constitutes cardiovascular disease. And what it can be explained by is some of the health behaviors that are so common in US population and globally too. So, and the top one you can really imagine is poor diet, right? The red line is poor diet and shows how poor diet is prevalent in our US population. The green line is inadequate sleep. So the sleep has become more and more, as we have researched, such an important factor in how it affects our overall health, not just heart and brain health, right? So inadequate sleep and physical activity. We need to do, just like how John Lewis started us on a very energetic note. I wish we can incorporate that kind of thing in every day of our lives and in most things we start. It'll already make our minds so rich and to even learn more when we have done some physical activity before. And of course, the other big reason why heart disease will continue to remain the most important cause of morbidity and mortality, which is basically deaths, is because of the high prevalence of risk factors that we have. Hypertension, you can see the high rates of hypertension we have in the US population now, and it's projected to increase even further when we go up to 2050. Similar with obesity, right? We have so many new medications out there, but still the weight seems to be growing up for our US population, and similar rates with diabetes as well, although we seem to doing a better job in cholesterol levels, right? So all this shows that heart disease are here to stay and we need to do something about that. And yes, every now and then we have a new virus come out. We have a bird flu thing going on right now. We have COVID, monkeypox. But guess what? Most people ultimately will still die from heart disease. So I remind everyone that yes, we need to pay attention to the current epidemics that are going on, but don't forget, heart attack is the silent killer that we all have to can't ignore. So I also want to give a little bit of historical context, right? So heart disease, just like dementia, it affects everyone. Young, as I just showed you, that even younger people are susceptible. The rich and poor, common people and leaders. If you remember this photograph, which is a very famous one from the end of World War II, this shows Churchill, Roosevelt, and Stalin. And interestingly, they were, coming together with a plan after World War II. And what is interesting is that all these three gentlemen actually died of stroke, and the poor health of Roosevelt has actually been blamed for some of the Soviets' aggression in the Eastern Europe that happened after that. So you can see how when these medical conditions are not just for common, but everyone can get affected, and it can change policies, politics, and have huge implications. So as we are looking at the cardiovascular decline, we were happy that cardiovascular diseases have been declining for some time with new treatments. So many medications are out there, and availability of stents, bypass surgeries, and everything. But over time, as I've shown you, and the projections that I just showed you, it seems like it's all plateauing. And why is it plateauing? Goes back to what I just mentioned. It's the risk factors that we all are experiencing in our population is still pretty high. So you can see epidemic of obesity that I just mentioned. 1/3 of US children are obese. So if they're obese in younger ages, they're going to be obese growing up as well. And the kind of diet and physical activity patterns that they start doing at a young age is pretty much what they're going to follow, probably get worse as they grow old. Smoking is still common, and diabetes rates are soaring. So the picture of what I just showed you, the projections and all, it's for a reason they don't look good. And of course, you have heard a lot about this, that one of the big reasons is the healthy diet, right? You might have heard of the phrase that you are what you eat, and you can see the amount of trillions of dollars that are spent in marketing foods to you that are, deceptively unhealthy, but you feel like they are the most easy way to get nutrition. And that's where we tend to uh, uh, give me 1 second. Yeah, that's where we tend to make poor choices at times, especially when people are stressed, have limited access to food. It can be a challenge. I mentioned about disparities, and I'll touch on this briefly. And I mentioned that um, it affects people of color. Just like in dementia, non-Hispanic blacks are more than twice as likely to have heart disease. Even though the rates are coming down, their disparities are still persisting. So all the policy changes that are happening at the top level, we still need to do a lot more over here. And you might have, if you've heard my talk before, I am very interested in geographic disparities. We have done some research in this area, and again, it points us to the same areas where health is not good, and that includes Georgia, right? So we had shown that this region of the United States, southeast region, is famously called as the stroke belt because the stroke mortality and stroke incidence is so much higher in this region. Turns out it is the same region where poor cardiovascular health persists. It's also the same region where dementia deaths are higher. So again, is what are we doing differently in this part of the United States where we are more vulnerable to having these chronic conditions? Heart failure also is pretty high. So again, a lot of it is still blamed on nutritional factors, physical activity, and the amount of stress that people might have. So you have learned through these awesome BrainTalk live sessions about how dementia is really an umbrella term. It's a syndrome, right? And of course, Alzheimer's is the most common. But if you look at the pathology, a lot of Alzheimer's patients will have a vascular pathology as well. And that points us that all these risk factors that are out there are affecting, in some ways, probably Alzheimer's as well. So this is why these two conditions are so linked. And, the more I research, it points me to the same direction again and again. And when we talk about these risk factors, which such as hypertension, diabetes, high cholesterol, right? They in the heart disease world, we have learned that what starts as a normal artery, like your blood vessel, it's when these risk factors keep on are persisting and they are uncontrolled, it leads to formation of these plaques. And the plaques then finally have the first cardiovascular event, which is like a heart attack or a stroke or something like that. And then if these risk factors still persist, that is people, it's in people it's not control who have uncontrolled hypertension, diabetes, it can lead to another event or further disability or death. So the risk factors are operating at all levels. And that's what we need to emphasize in our role in healthcare is to reduce them or stop them as early as possible and throughout the lifespan. A very similar picture plays out in Alzheimer's as well, right? You're trying to prevent things from happening in the first place, and that's happening at a vascular level. And when people already start developing symptoms of Alzheimer's or dementia, it's almost like the first heart attack or first stroke. It's things have already gone too far, and we need a lot to do early on in our lives to prevent that from happening. This is one study that I like to show to emphasize how important is the role of these risk factors. So it's a complicated graph, but let me simplify this for you and just show you that this panel over here is for men and the other one is for women. So we have stratified the results by gender. But if you have no risk factors, meaning no hypertension, no diabetes, no obesity, you have a very minimal risk as you grow old from 50 to the age of 90. The moment you have one risk factor, which is uncontrolled, your risk jumps from 5% to 36% in men and 8% to 27% in women. And then the more risk factors you add, the more your risk becomes. So this kind of an exponential risk is for a disease is with the risk factors. We need to pay more and more attention to controlling the risk factors in the first place. So in in since I think like ages, we have all wanted to find one thing that can make us all age successfully, be healthy, be free of all ailments. And in medicine, kind of in the same way, we also try to do the, looking for that one holy grail, right? Like one medication, if you start taking, or a multivitamin you start taking, just cures us for everything. So the pursuit is still on. And there was a time more than a decade ago when it was all about statins. You take a statin, and can it reverse heart disease, heart failure? Can it reverse cancer risk, dementia risk? So yes, we know statin is a very good tool, and a lot of you who have high cholesterol or are trying to prevent heart disease may be on this. But we need to keep in mind that's a great tool, maybe not for everyone, but again has a lot of good effects. Then came metformin. Is metformin the wonder drug? It was given for patients with diabetes, but it started showing effects in other areas of health as well. Then came recently Jardians, right? You've heard of Ozempic, Jardians, and all these medication just seem to work for everything. Recently, it was approved for even sleep apnea, but we know that they cause weight loss, they cause reduction in, of course, diabetes, but also prevent heart disease, kidney disease, and all that. So again, these are very good tools we have, but we still need to, get to a point where we're not dependent on medication, but doing more things with our health. And of course, there are newer things coming out about stem cells, monoclonal antibodies, and other things. I always like to, much as I'm always excited about medications that have, great effects. We always want to, also go to some time-tested strategies that have been known to always help. And that brings me to this slide where that what's affecting the biggest conditions that are affecting in the United States, like heart disease, cancers. If you really start digging into what are the root causes of it, which is basically the risk factors, almost 2/3 are from poor diet, physical inactivity, and tobacco, right? So yes, we have drugs, but won't it be nice if we can somehow address some of the lifestyle issues and prevent not just one condition, but several of these conditions that I show you in this top 10 chart, right? Um, and we know this plays out very similarly for dementia as well. And you've seen this slide probably in this BrainTalk live series where earlier it was showing that even 40% of dementia is potentially modifiable, which means you can prevent it. And we know about these conditions because they are very similar to what causes heart disease, like hypertension, diabetes, stopping smoking, reducing air pollution. So a lot of these things are similar. And if we try to control the risk factors, we will not only prevent heart disease, we'll also prevent dementia as well. So 1 in 3 dementia cases can be prevented by lifestyle factors. I would almost, take a print of this and put it on our fridge, right? So before we eat food, or we always reminded that look what we can prevent with just lifestyle alone. In medicine, we are always interested in trying to find patients who are high risk. And that is of course, a very obvious approach because we want to prevent them from having these conditions like strokes and heart disease and all that. And that strategy is always useful, but it does not affect in some ways the large population who do not see doctors, or who are and especially the young who are also reluctant to come to docs. The population strategy, which is basically shifting the entire risk factor burden in the population to a more favorable level. That's another approach of promoting prevention. So, high risk is when patients who have family history and other things, they come to a doc and they get a prescription of these medication, lifestyle, and all that. Population is when everyone in the population, regardless of the risk factor, is targeted. To give you an example, in New York City, when they reduced or banned trans fats, the health levels over there in terms of cholesterol and all that, it all improved universally for the whole population. If you reduce salt in the diet and make it market in a way that it's emphasized that this product is high salt and should not be taken, these kind of measures affect the whole population and can have huge benefits in improving not just our individual health, but of the entire population, right? So I wanted to talk about why this concept of cardiovascular health is such an important one, right? And that is because we want to reframe our thinking from not just talking about conditions and diseases, but about health, which is what a positive construct is always so important. And I feel like docs can more work like coaches to promote health rather than always talking in the terms of disease and trying this treatment versus that. So, American Heart Association over a decade ago partnered with several big universities and came up with this idea of life essential eight. It was initially called seven, and then added sleep on. As I mentioned to you, sleep has emerged as one of the biggest risk factors that if you have poor sleep habits, you're likely to have a lot of chronic conditions coming up in the future, right? So I'll show you the tool at the end of my presentation, but the idea is this: that if you put in your metrics, which are your these metrics that I'm going to show you over here, like how well are you eating, how are you managing your weight, what's your most recent cholesterol numbers, blood sugar, blood pressure, and just putting in like how much of physical activity you get, and if you use any tobacco, and the sleep, as I mentioned, is the newest risk factor. It would just tell you where you lie on your cardiovascular health. And I mentioned cardiovascular health is like your brain health too. And the resource from American Heart will actually give you resources to manage each of the conditions, so you can see your numbers improve. So it'll give you a global number, and you can track that and see how well, if you do an intervention, how well it does it change things. This is a snapshot of what US how in US the cardiovascular health metric looks like, right? You can see the red is all bad, and the red is so bad that in fact when you ask how well are people eating a high ideal diet, which is in green, you almost cannot just see it, right? Over the last several decades, we have made great stride in smoking. So a lot of people don't smoke now, which is great. But there are so many other areas we need to improve on, right? People like John Lewis are helping budge this trend, which is in physical activity. But again, there's so many other metrics that we need to improve on. And it's and beyond these metrics, including sleep and also stress. So stress and the areas where we live can all start affecting these vascular risk factors. So something to keep in mind that um, having an optimistic outlook, reducing our stress level can, in fact, in turn, also help these things. And that's another area of my research because I love understanding how we can minimize stress and the harmful effects of stress. I want to show you some examples of studies that we did and how does the cardiovascular health actually have an impact on different things, right? I told you it, of course, is heart protective, but also brain and other conditions, right? So this is just, in our research, what we try to do is give some numbers to things and um, classify each condition into different levels. So I'll give you an example over here. Let's say we have physical activity. So if you're exercising, and if you're not getting any physical activity, you get a score of 0. If you get 4 or more times per week of good physical activity, you get a score of 2. So we categorize each of these vascular and heart factors into 0 to 2. And that's how we come up with, okay, we aggregate these scores and figure out, okay, you have poor cardiovascular health or you have an average, and how you optimize it. What is interesting is if you make even a small change, just even a small change, right? It can have huge benefits, right? So even if you cut back on smoking or go from smoking to no smoking, even that 1 point change can lead to enormous benefits and across several conditions. So we have shown in our research that not only benefits cardiovascular health, it benefits, of course, kidney disease, cognitive decline, and a whole range of risk factors. Even depression, people's mood improves, incidence of cancer has gone down. So again, my going back to the same point is, these, if you control the risk factors, it is similar to taking one of these medications that have so many good effects. It can help prevent so many other conditions, right? And again, the emphasis is on across the lifespan, right? So the sooner we start doing this, the better impact we can have on our future brain reserve and cognitive reserve. Just like I showed you how arteries get clogged in with cholesterol and other things, and it's harder to reverse, but if you can prevent it and even if we have some and start doing these things at the right time, we will minimize the damage that is happening inside our blood vessels. And similarly with Alzheimer's, it will reduce our risk for heart disease and strokes, right? Again, this is makes the same point that all these, if we are able to, with each of these risk factors, how much Alzheimer's cases can be prevented. And all these risk factors are very similar to what we have for heart disease. And again, we do studies in the vascular in our vascular lab too to understand what kind of things are happening. So we all know that any kind of a disease condition that develops in us is happening partly from genetics, partly from environmental factors, and some of the choices we make. We can change our parents, but what we can do is the environment we live in, how we manage our stress, and these medical conditions, including the choices we make, will help us achieve optimal brain health and heart health, right? Now, at a clinical level, we also want to understand that when we know that we have some evidence-based treatments out there, right? We did this study to understand, okay, what's going on. We have some great drugs, and we know the lifestyle approaches that are out there, right? What's really happening? Are people using it or not using it, right? So we tracked just this use of aspirin. So all these patients had heart disease, and we tracked that. Unfortunately, people stop taking some of the medication. Either they don't feel the effect of it, because again, the effect is not happening to how you feel, but it's all happening inside your blood vessels, right? We found surprisingly that 40 to 60% of the patients were not taking the medications that were prescribed. And that's a huge area for us to improve on, is what can we do to make people understand the value of lifestyle, the value of taking these medications timely, right? To make a change for the better, right? Another intervention we like to do is, again, this is a study that we started a few years ago, and it's focused on, again, how can we emphasize the value of lifestyle to our people, right? And the idea is that we meet in group sessions in our over Zoom, just like how you have BrainTalk Live, and we train people in making these good choices, right? Sometimes we are stressed and don't make the right choice, so we discuss about tools and how we can manage stress better and understand the effects of each of our emotions on our lifestyle choices, right? We talk about medication adherence and all that thing, right? So again, all these interventions are on, but the whole our mission is really to improve the health of our population and individual patients that we see. So I would like to wrap up by reminding again, what gets measured gets done. Like, we are, as scientists, are trying to measure the population health of US, right? At an individual level, you can monitor your own health and see what works for you, right? The current state of our cardiovascular health is really poor. Even less than 1% of the US population has ideal cardiovascular health. And that tells you why the charts that I showed you about projections look still pretty grim. And I also mentioned to you from the research that we have done, it may seem overwhelming that I have all these 8 factors to improve on if you have had poor lifestyle for some time. But even if you pick up one of them and try to change it for the better, you are going to see a remarkable reduction in disease. And also it can help reduce disparities, right? I've already mentioned to you that since so many of these factors that affect brain health are also affecting heart health, might as well work on addressing these risk factors for better aging. And again, we don't feel the symptoms of some of these risk factors, but the changes we have known about this, that accumulation of amyloid and tau starts happening 15 to 20 years early, which is very similar to how atherosclerosis, which is the hardening of the arteries, happens earlier in life. Which again points me that this is a lifelong approach that we need to kind of shift towards. So whenever you have time this month, try to get on the website for American Heart Association, do your own Essential 8, see where your numbers are, and it will give you resources, and you can pick up even one of them to change for the next month, right? And what we talk about over here is not new. We kind of have even Hippocrates, who had mentioned this, that if you could give every individual the right amount of nourishment and exercise, not too little and not too much. He even talked about not too much at that time. We could have found the safest way to health. And with that, I'd like to thank my team. Of course, we work with Dr. Monica Parker as well. And I'll leave you with this cartoon that it's all about getting up and moving. Thank you.
Thank you, Dr. Kulshreshtha. I hope everybody has a better understanding now about how the role of high blood pressure, heart disease, and cardiovascular health, and the idea that every one of us can do a little something to make it less likely that our cardiovascular health affects our brains. So, Dr. Kulshreshtha, there are several questions in the chat, and I'm going to start with one that's really easy. It says, is there anything we can do to remove the plaque buildup in our blood vessels?
That is a great question. So plaque, we have seen studies where the unfortunately for in U.S. kids, the kind of diet that they've had, they've experienced, the atherosclerosis has started at the age of like 15 years, 20 years, which is really unfortunate. Um, the good thing is when we start practicing a healthy lifestyle, a lot of these conditions can be reversed. You might have heard of so many of the cardiologists who written books about a Mediterranean diet or a Mayan diet. It can actually reverse a lot of these conditions. I think the problem is how best can we adhere to them, because not everyone seems to enjoy it. And what is enjoyable is all our food industry coming up with coloring of foods and making it more savory. But I think that's where the challenge lies: is how do you stick to these diets that are known to be healthy? And yes, to answer your question, atherosclerosis can be reversed.
Okay, it's not like they're going to do zero res or a Stanley steamer and just suck the cholesterol out and your vessels are all right, right?
Yeah, well, if you get to too late stages and you're not able to change it with lifestyle, that's what we do in when we put a stent on. Like, your artery is all clogged up, and you have to make a instrument that can help dilate it. That's You don't want to get to that stage. If you can avoid it, through medications, through lifestyle, the better it is, right? But even if you have a stent, you don't want the stent to get clogged again, which is what I showed you in that nice graph that these risk factors are operating throughout our lives. They're all around us, right? Uh, Even if we are stuck at some stage with atherosclerosis, for example, already done, arteries already stiff, you can still work on it to change your life. That's the beauty of being able to reverse with lifestyle as well as medications.
Okay, on that note, when we start talking about reversing plaque formation and cholesterol in our blood vessels, Mr. Hutchinson has a couple of questions here about cardiovascular structures. And I'm of the opinion that everybody has a heart and has blood vessels. What's different? So Mr. Hutchinson says there are differences. What's the anatomical difference that makes a difference in people with heart disease or without heart disease? What might he be referring to? Because I didn't quite understand.
Yeah, I think some people are genetically predisposed. I know, for example, in our South Asian culture, people get heart disease very early. And I mentioned to you about that story where people in their 40s are getting heart attacks, right? Now, there is a genetic risk, but which is you can't do much about it. There is, at least the way science stands at the current time, there's not much to do about it other than get screened and follow up regularly with your doc and cardiologist, right? Um, so, but beyond the genetic risks, there are risks that we tend to accumulate, and that is what I was making a point about modifiable risk, right? So, red meat diet, which if you eat a lot of it and all that, those are risk factors that we are adding on for ourselves. Those are ones we can address. So, when you look at patients who have developed a heart disease in their lifestyle, early or not, and the ones who have not, it is very similar to like dementia. You are striking a balance between your genetic risk that you inherited plus the lifestyle that we made as a choice, and plus whether did we comply with the medications we were given when we developed the condition. It's accumulation of all of that, right? So I hope that answers the question. I don't think there is a huge there's the diseases can manifest in different ways. For example, as I mentioned, in women, heart disease can manifest in a somewhat of a different way, but more or less, these risk factors play a similar role for all of us.
Other question, Ms. Robinson asks, you did the study, you had a flyer up in the latter part of your program presentation. Do you have any more need of participants in that study? And can we have that information, please?
You are very kind. Yes, I think studies are important for us because we are looking for ways to make lifestyle more enjoyable, right? And lifestyle more doable because if it involves, we have also figured that making too many drastic changes in anyone is very difficult, right? That's why when I discuss with my patients or, go about designing these interventions, we all aim for small things, small changes is how you make things sustainable. I'm happy to share flyers of a study that we are doing, and it's very non-invasive, meaning that we're not doing any drugs and all that. But there are other studies we are doing which involves drugs too. For example, there is the largest study which is called Preventable, where we are testing how the drug that I talked about, which is called statin, can help prevent memory decline. So if you're interested in drug studies or lifestyle studies, please reach out and I'm happy to share. I was just sharing a small sample of studies we do, but I'm interested in like what can we do, right? Like lifestyle, of course. If lifestyle doesn't work, what medications are already out there that we can do to improve our health.
Okay, so for those of you who may have heard and weren't really clear, a statin is a medicine that helps reduce your cholesterol. And so for some people who've been already diagnosed with a stroke or a heart attack, they've been placed on a statin. That would be Lipitor or atorvastatin, rosuvastatin. So those are medications that Dr. Kulshreshtha is talking about from the preventable. Can we put people on these medicines a little earlier and prevent plaque formation altogether? So if we can, do you want them to email you, Dr. Kulshreshtha?
Yeah, I can maybe share my lab email with Crystal and they can reach out to us over there.
Okay, but so just to reiterate here, we have studies that your lab is doing that are lifestyle interventional studies that have nothing to do with medication. And then there are some studies that you have that are looking at medicines that have been repurposed to help prevent disease, like statin studies.
That is correct. I am going to share the preventable study. This is the biggest trial that's happening in the United States for elderly participants. And it's just because we have no data in people over the age of 70 and 75, right? This trial, which we are a site for, is actually trying to answer the exact question is can statins, which have been known to protect against heart disease, can they also prevent dementia? So if, I just, you can look about the trial over there. Again, it's a safe drug because we know that it has been used for several almost last few decades.
So I have pulled it up here. So for people who are asking questions, Dr. Kulshreshtha is the site PI here at Emory. But if the question, the telephone number that you should call is 833-385-3899. 833-385-3899. And according to the Preventable website, you can get these questions in English or in Spanish. The study is the Preventable study. 833-385-3899, or you can Google it. Preventable, just like it sounds. Okay, I got that piece in there. And if you go to the website, you'll learn all about what they're doing.
I see another question in the chat about what tests can be determined can be done to determine if you have plaque buildup in your arteries, right? That's a great question. So, if you want, there is a test called coronary calcium scoring, right? That checks the amount of calcium that's getting built up in your blood vessels and how hard your arteries are. That's a really good test that is already out there. You can ask your primary care providers about it. And that is one test, right? So that tells us structurally what's happening. Now in our heart disease world, we try to divide tests into two different kinds. One is the structural one, where you're seeing the image of the heart, just like how you detect cancer cells, you are trying to detect plaques over here. The other is functional tests, where we make you exercise or give you drugs where your heart pumps faster, and then you are able to see if you have a heart disease when you are stressed, right? So I think both kind of tests have the importance. That's why the, not just the structural ones, but the functional ones are as important at times, especially if anyone has symptoms.
Okay, I'm checking to see if anything else. Okay, what about the cardiac calcium test? Can you explain that? I had that done. I know what it is. I don't know that I believe in it, but
Well,
talk about
well,
that calcium test.
well, we all want to know what's going on inside our blood vessels, and imaging is, has, I think, the diagnostic world in Alzheimer's, in cancer, and cardiovascular has really, really, been revolutionary. And when you can see what's happening inside with an image, I think it gives you a fairly convincing picture. Yeah, that's what's going on, right? So that's how we detect most cancers too. So I think the heart disease world has this calcium test, and there are more other tests too that we do, like PET scan, cardiac PET, and all that. But the calcium scan is one of the very cheap. You can get it done for, again, depending on your insurance, but I've seen people get it done for even less than $100. And it can give you an idea of scoring. And if your score comes zero, that's a very good score to have, by the way. Unlike other tests, here's a zero is very good. So zero means you have zero calcium, and that's a very good sign that you have very limited calcium and atherosclerosis in that way, and you do not need a statin. But if your number is higher, likely you have something brewing up over there, and time to do, get on statins or talk to your cardiologist about, or primary care doctor about that.
Okay, so thank you so much, Dr. Kulshreshtha. Thank you for spending your afternoon, your 1 hour in your afternoon with us and pinch hitting for Dr. Gottsman. We look forward to having more people enroll in your studies. And for people who have asked, the study that he's referencing primarily right this moment is called Preventable, and it's for people aged 75 years of age and older. But he also said that there are other studies that they have. So when we do the follow-up email and send you the tapes or the PowerPoint presentation from this presentation, we'll have more information about some of the other studies, and you can contact his research lab to get enrolled in those. Great job, Dr. K, according to those. The other thing is here, because research is the name of the game for us, we have a number of neurologic studies that are observational studies. No, we're not giving you drugs either, where we're just having you come in once a year, do some testing, look at your brain, maybe even give us some blood for some biomarkers. That's the Emory Healthy Brain Study, and that's for anybody 18 years of age and older. The PAN study, which is for other people 18 years of age and older, we'll take some blood from you, do a brain MRI, and that's all there is to it. So if you're interested in any of our research studies, we put in the links in the chat. Please give us a call. We want your participation in research. If it's not for Alzheimer's, the cardiovascular part is really, really important. I urge you to get involved. Thank you so much, Dr. Kulshreshtha and Emily. That is it for me.
Thank you, Dr. Parker. Remember that help is always available to you if you are a caregiver for somebody with Alzheimer's or with dementia of any kind. The Alzheimer's Foundation of America has a national toll-free helpline available 24/7 for you in order to give you help that you need at any time, day or night. And it is a resource that we really think is valuable, and don't despair. Help is out there.